2020 has been a tough year for all of us, and AWS partners and customers are no exception. What we all want is to get through the pandemic and rediscover and perhaps reinvent the way we live and do business, hopefully in the more resilient post-COVID world. I am Oksana. I lead the Global Healthcare and Life Sciences Partner business at AWS. And today I'll show you what we've been doing along with our APN partners to both respond in real time and build for the future. Both companies and individuals have been challenged to rediscover new ways to work, learn, play, manage our daily routines, and stay connected. Several of the industry verticals where AWS is deeply engaged have been disproportionately affected by the pandemic in different ways. I'm going to highlight the response we have seen and been part of in healthcare and life sciences, travel and hospitality, and retail. With this definition of resilience in mind, the capacity to recover quickly from difficulties, toughness, you will see that many of our partners have truly stepped up and shown this toughness and the capacity to respond, recover, and innovate with us. And it's been highly rewarding for the AWS partner team to be a part of this response. We stepped up to help our partners build and promote both direct and indirect solutions and services for customers adjusting to COVID. We think of direct solutions as those that help us better understand and diagnose the disease and deliver care to COVID patients. Indirect solutions are here to support remote work and delivery of products and services, while many of us around the world are affected by quarantine and travel restrictions. In healthcare and life sciences, we saw the full range of both direct and indirect COVID solutions emerge over the last 6 months to both improve research and development and deliver medical care in new ways. On the direct solution side, and I'm only scratching the surface here, we have partners of all sizes like Illumina, Cerner, ClearData, HC1.com, and DXC innovating on AWS. Illumina's SARS-CoV-2 NGS data toolkit helps researchers better understand the virus and our biological response to it. It can detect viral sequences, analyze host responses, and easily share research findings to public databases. Cerner provided a COVID-19 data set to researchers to support epidemiological studies, clinical trials, and treatment. For example, the Oklahoma State University researchers used Cerner's EHR data to build predictive models of COVID mortality. DXC has deployed a case management solution in the UK to help with the COVID-strained medical supply chain. And in the US, ClearData has provided a secure and HIPAA-compliant environment to Everlywell to build the analysis and processing of their home health kit offerings. With a sudden hit of COVID-19 in the world and the lack of testing initially available within the US, Everlywell saw an opportunity to leverage their capabilities to help with coronavirus testing efforts. They were able to build on their home test technology and rapidly offer and scale up the delivery of their COVID-19 solution in collaboration with ClearData and AWS. They were able to leverage incentives from AWS to help fund this technology expansion, and as a result of working with ClearData, in 2020, Everlywell has helped hundreds of thousands of people get tested for COVID-19, diabetes, colon cancer, vitamin deficiencies, high cholesterol, and more, all without leaving a home. And HC1.com has built tools for Sonora Quest laboratories to better protect the residents and staff of long-term care facilities. Diving deeper on their example, HC1.com, one of our healthcare competency partners, has stood up the CV-19 Command Center utilized by SonoraQuest to manage COVID-19 in long-term care facilities in Arizona. SonoraQuest needed a way to provide COVID-19 population health and coordinated care data analytics to the Arizona Department of Health Services and the State Health Laboratory. And HC1 CV19 Command Center gave them a comprehensive solution to determine COVID hotspots and advanced analytics that support effective testing of those that are most in need. And importantly, these are near real-time insights that are critical for rapid intervention when infection hotspots are found. In addition to such direct innovations that help researchers better understand COVID biology and healthcare providers to deliver care, we also saw a new wave of digital innovation in response to the need for remote engagement across healthcare, life sciences, and genomics customers, and to better support all patients and research study participants. These innovations span the full range of telemedicine, core clinical workloads, interoperability, and clinical trial transformation. In telemedicine, Cerner needed a scalable, elastic approach to meet surging utilization and global demand for virtual health capabilities. And the Amazon Chime SDK in Cerner's suite of virtual health solutions has enabled embedded virtual experiences and increased global access to care. Huma, which provides virtual health with remote patient monitoring, telemedicine, and digital biomarkers as part of their solution, works with clients to enhance operational efficiency of remote care beyond what telemedicine alone would provide. They have shown 60% reduction of clinicians' time on the telephone using Huma's remote patient management solution, and clinicians were also able to care for 50% more patients using Huma's RPM. We also made strides with modernization of core clinical workloads by partners like Epic and GE Healthcare. We're working together with Epic on system sizing, security, and availability best practices to help our mutual customers run Epic's mission-critical software on AWS. And GE Healthcare was the first healthcare company to have an artificial intelligence application for medical imaging deployable to a medical device cleared by the FDA, the Critical Care Suite. GE Healthcare have since added AirX and AirRecon DL to their growing list of FDA-cleared applications. They're also launching Critical Care Suite 2.0 at RSNA this year. And all of these were trained on SageMaker. In the third solution category, we saw a greater emphasis this year on interoperability solutions by partners like Change Healthcare and Redux. The pandemic has dramatically shifted the care delivery model, and consumers are carrying an increased share of the healthcare cost burden, and providers, payers, and patients all need timely access to data so they can make better informed decisions in real time. Change Healthcare is paving the way for health IT interoperability that eliminates cost barriers, meets federal regulatory environments, and sets a stage for future innovations to better address both value-based payments and consumer needs. And at the business level, 2020 has also shifted its IT priorities for hospitals and clinics. In response, Redux has built rapid deployment solutions for applications such as virtual care and lab testing that are needed urgently. Application providers partner with Redux in order to go live with fully integrated solutions in as little as 2 weeks. And with the recent AWS Marketplace listing for Redux EHR integration, they made it even simpler for customers to build with them. Lastly, and just as exciting, is the latest wave of clinical trial transformation by many of our life sciences partners. The pandemic has exacerbated known vulnerabilities in the clinical trial process, patient recruitment that was still largely a manual process dependent on physician referrals and in-person screenings. So data-driven screening and digital recruitment and patient management workflows reduce the burden of trial on staff and patients alike and make clinical trials more crisis robust. Deep6 AI uses artificial intelligence on real-time structured and unstructured clinical data to accelerate the entire clinical trial process, boosting high-performance research capabilities, both for healthcare providers and health systems and life sciences companies. This support is relevant to all trials in progress during the pandemic. And the need is even more acute for companies developing antiviral treatments and vaccines for COVID-19. 4G Clinical has stood up nearly a dozen COVID-19 studies in the past 5 months, with average delivery timelines of less than 3 weeks from award to go live, and in some cases as short as 5 days. Through a combination of their proprietary DevOps tool, DOSS, and AWS's flexible cloud services, 4G clinical study delivery teams are able to provision the required environments in minutes, on demand, greatly accelerating study initiation. This agility also allows for last-minute protocol changes based on regulatory guidance as the science around COVID-19 continues to evolve. And lastly, Philips Healthcare continues to expand its footprint to enable remote data capture from cloud-enabled devices. Diving deeper on the Philips example, Philips Healthcare has been engaging deeply with AWS for a number of years, building its Health Suite digital platform for connected medical devices on AWS. In their work with Ypsomed delivery systems, Philips helped deploy a connected drug delivery solution to monitor medication adherence, which is especially important for self-injected biologics, and to manage smart devices for clinical trials. The integrated Ypsomed solution encompasses a connected medication injection device, smart services for device management, and a cockpit dashboard showing relevant device data. Building this cloud-based solution on Philips' HSDP, rather than from scratch, reduced Ypsomed's time to market by 2 years. And all 3 of our companies worked closely together to help commercialize it once it was built. The Ypsomed collaboration was underway before COVID, and as a result, was ready to go to support our pharmaceutical companies searching for solutions like this, which are especially well suited for remote clinical trials, a much needed capability throughout the pandemic. And like I said, these examples only scratch the surface when we consider the breadth and depth of our healthcare and life sciences partners' response to the pandemic. So I want to take this opportunity to recognize healthcare and life sciences competency partners in particular. They are leaning in with us and bring a strong blend of both cloud and industry expertise to our customers. So I would encourage everyone to learn more about their work. And of course, healthcare is not the only industry that had to adjust and innovate in response to COVID. Travel and hospitality is among industry sectors most heavily affected by the pandemic. But that hasn't stopped our partners' efforts to innovate and frequently reimagine both business and consumers' customer experience. I'm excited to announce that earlier today, we launched a new differentiation program, the AWS Travel and Hospitality Competency. We congratulate 27 of our best-in-class inaugural travel and hospitality competency partners on this achievement. This competency program helps customers identify and choose top global AWS partners that have demonstrated industry-specific technical proficiency and proven customer success. These partners provide innovative technology solutions and consultative services to accelerate industry's modernization and innovation journey from behind the scenes operational efficiencies to guest-facing customer experiences in travel and hospitality. These partner capabilities span travel and hospitality data 360, digital customer engagement, smart assets, core applications, and specialized consulting services. And today I want to introduce you to three of them, these partners, to showcase how they are driving innovation amidst the COVID-19 pandemic. As our industry customers plan for recovery, it all starts with data. And travel and hospitality companies are awash with data, but often not extracting the most value from it. They seek partners that can help answer essential questions. How do I identify travelers who would be most likely to be the first to want to get on board again, and those that would follow soon after? And consequently, what are the markets we're going to restart? The Travel Recovery Insights Portal TRIP, powered by AWS technology partner 3 Vectors, in collaboration with the Airlines Reporting Corporation and the Boston Consulting Group, helps to navigate the changes surrounding COVID-19 by offering a comprehensive look at how demand for air travel is returning. Quoting airline customer JetBlue, 3 Vectors' ability to analyze a global database of travel shopping requests and responses in real time is an incredible asset for the industry, and even more impressive at a fraction of the cost of developing dedicated internal resources. Now, when we travel, we all value personal, customized, tailored experiences on the road. In this context, customer service channels are central to put the right offer or an appropriate message in front of the right customer at the right time. With COVID disrupting travel for many, they're struggling with an influx of calls and inquiries with a significant impact on customers and business. Technology partner NLX helps to transform contact centers, including full automation of high-frequency requests, to reduce peak call volumes, resulting in lower service costs and enhanced customer experience. So next time you want to know if your flight is still on time, instead of waiting on hold, you can now have an instant and intelligent conversation with Alexa. And finally, contactless operations. The travel and hospitality industry has been leading this work long before COVID-19. Think mobile check-in or digital boarding passes. However, the last 6 months have acted as a catalyst to an industry-wide scrutiny on hygiene and cleanliness, which in turn accelerated the demand for contactless operations. In the heat of the crisis, AWS partner Illenium Automation quickly developed a self-service technology that can detect a passenger's temperature, heart rate, and respiratory rate, and ask a series of questions from a distance of up to 1.5 meters at airport touchpoints, such as kiosks, backdrop, security, or immigration. And in a sense, that device then becomes a screening station for potential symptoms of COVID-19. And global customers like Etihad Airways are partnering with Illenium and AWS to not just overcome disruption that's taking place right now, but to build a more resilient business and drive innovation for the future of travel. And of course, similar to travel and hospitality, retail has seen its own share of disruption with the pandemic, which both introduced new challenges and accelerated innovation. By some estimates, including McKinsey & Company, the pandemic collapsed into 3 months the broader adoption of e-commerce that otherwise would have taken 5 to 10 years. Fortunately, AWS has an elite set of retail competency partners that have been able to help retailers reinvent themselves to adapt to new shopping trends that have disrupted their supply chains to store experiences. Last year at reInvent, we launched the Retail Competency, which showcases partners that provide solutions across the end-to-end retail supply chain. Let's take a look at how a few of them help customers to adapt and innovate at record speed. When physical stores shut down all around the world due to government's regulations on social distancing, store inventories became stagnant, exposing retailers to even greater inventory costs. Are Happy, a toy retailer in Brazil, was not spared. During the temporary closure, the central warehouses were overwhelmed with online customer orders, and which caused them to lengthen delivery times and negatively impacted their customers' experience and loyalty. But with the help of VTEX, a fully integrated e-commerce marketplace and order management solution provider, Happy was able to quickly repurpose their stores to micro-fulfillment centers to support their online orders, shorten delivery times, and improve overall customer loyalty. At the same time, another retailer in the US was dealing with a complete opposite problem. Harmons, a grocery chain in Utah, saw their physical store sales skyrocket, since they were classified as an essential business. In normal times, soaring sales to some degree would be a welcome event. However, the panic shopping instigated by the pandemic caused out of stocks on the shelves and in their distribution centers. Harmons experienced supplier shortages and warehouse bottlenecks, with some orders quadrupling for high-demand items such as flour, tissues, and even Spam. Harmons worked closely with their analytics partner Domo to build real-time insights to quickly adjust orders and store labor to manage the volatile demand spikes. Harmons was able to quickly identify the top-selling items and potential out-of-stocks, and had their distributors prioritize them to reduce warehouse bottlenecks. They also leveraged insights on sales and expenses for each department at every store to manage ordering and keep high-demand items on the shelf. Another example of AWS Partners stepping up to help retailers quickly adapt to new shopping behaviors is the next story on Wawa and Mobiquity. Wawa is a US retail chain of more than 850 convenience stores with over 600 stores that sell fuel. With a rising demand of mobile ordering, they quickly noticed that they needed to lower their third-party delivery costs, which were incurring a 20% premium for each order. And within that same mobile ordering environment, they also wanted customers to have access to a greater selection of products. But the delivery providers for their mobile orders were only offering a condensed menu that was common across all stores, rather than a more robust assortment that would align better with local markets and inclusive of regional products and test items. To address both of these concerns, Wawa and Mobiquity worked with DoorDash to develop an in-app experience that would be similar to the customer's experience normally with Wawa. There are many subtle nuances to how Wawa customers browse menus, but Mobility was able to simplify the path to purchase for the mobile shopper while still offering them a more localized menu. With Mobiquity's guidance, Wawa saved approximately 50% on delivery costs, and their average order value for delivery orders rose over 50% above their buy online, pick up in store experience. All of these examples of APN partners responding to the pandemic and innovating on AWS, and many more that I simply don't have time to cover today, speak to their resilience in the face of unprecedented societal change that all of us are living through this year. And we at AWS and on the partner team are proud to be a part of their journey. We're here to help our partners build, commercialize, and scale their innovations together, serving our mutual customers around the world. And we do believe that this wave of innovation born out of necessity will continue to transform and improve our lives well after the pandemic is over. So if you're not yet an APN partner, join us. If you are a partner, lean in. And if you're a customer, come learn more about our partner solutions. Thank you.